वर्षको उमेरमा चाहिँ हुँदाखेरि त्यस्तै अब सामान्यत अब गोठमा यस्तै टाढा राख्थ्यो त्यही भएर त 5 दिनसम्म पानी नचल्ने पानी कसैले त 7 दिनका पनि पानी पिन्छ तर आजकल कसैले त्यस्तो छैन गोठमा राख्ने चलन छ कोही अब कसैले टाढै राख्छन् भने कोही अब पहिलाको जस्तो त धेरै त पाइँदैन यस्तो घर आँगनमा यस्तै जस्तो भने अब घरमा राख्दाखेरि छुइयो यो छुइयो अनि छुइ घरमा बस्दाखेरि देउता बिग्रिन्छन् देउता बिग्रिएपछि अनि मान्छे बिग्रिन्छन् मान्छे बिग्रियो भने के हुन्छ बिरामी जस्तै अब पुरानो चलन अनुसार बिग्रिएर अब
त्यो 11 वर्षभन्दा अगाडि नै गुफा भन्ने एउटा अँधेरो कोठा भन्नु मतलब घाम नदेख्ने केटा मान्छेहरूलाई हेर्नु हुँदैन घाम हेर्नु हुँदैन कपाल कोर्नु हुँदैन अनि यता जताततै छुनु हुँदैन अनि दिउँसो घाम नअस्ताइकन उदाएदेखिको नअस्ताइसम्म बाहिर निस्किनु हुँदैन अनि बाहिर ननिस्के त्यस्तो गरेर 12 दिनसम्म राख्छ
पानीहरू छुनु हुँदैन तेलहरू छुनु हुँदैन नुनहरू छुनु हुँदैन अनि त्यो किचनमा गयो भने केही पनि छुनु हुँदैन अब हामीले छोयो भने पनि बिर्सेर छोयो भने सुन पानी गरिन्छ जसलाई त्यो शुद्ध पानी हुन्छ नि त्यस्तो गरिन्छ अनि
Now, for your question, this particular questions, it depends on the cultural settings. If you are talking about overseas, let's say European country, now these are frequently being talked about. So once if you normalize this kind of topic, it is basic human biology, and it wouldn't cause as much harassment, embarrassment when we're talking about it. Our local cultural settings, on the other hand, is a little bit more conservative, and therefore such topics are not openly discussed. When you don't discuss certain topics such as menstruations openly, that creates a lot of conflicting ideas.
Frankly, if you were to ask me, no, it's not properly addressed and discussed. People are still, what to say, it's a kind of a taboo subject. Nobody wants to discuss it, be it at home or in school or in public places.
When you don't discuss certain topics such as menstruations openly, that creates a lot of conflicting ideas. And majority of the guys, the boys, may not be aware of the changes in the human body for females. And they may find the menstruation something bizarre, something they are not familiar with. What I believe is most schools should have this biology, sex education incorporated as part of the curriculum. Now, if you incorporated that as part of the teaching curriculum, this will be the norm. Most of the school will have a school counselors. Now, in our settings, changes in our human bodies are mainly being taught by our parents. So if let's say certain girls, certain boys, if their parents do not touch on this particular topic, they may not be aware of the changes and they may have a lot of doubts. And now this is where the school counselors plays an important role. Let's say if a girl is having their first period in the middle of the class and she has never encountered this before and their parents are not around in the school environment, the school counselors plays an important role to educate and advise. I still believe that all schools should incorporate this as part of their mandatory curriculums. Now, if you have a textbook, if something is in your textbook, if someone talk about it in a class, it becomes a norm and no one will be ashamed, no one will be worried about it. So most of the biological class will have a sections on changes throughout the puberty, changes throughout the adolescence. And now this is the perfect time to discuss about the changes. When the girls have their first period, what are the changes behind the periods? What are the changes inside the womb? And why do you get bleeding during the first day of the period? So now if everyone understands the theory behind it and they don't have any further doubt, there wouldn't be such things known as embarrassment or difficulty to raise questions. In fact, majority of the students will end up asking more questions in the class open in order to understand and clarify any potential doubts.
Teachers, of course, must and should play a very active role, because next to the parents, I think the teachers are the ones that students look up to. And I think they should be open-minded about it, and they should be proactive, and they should be equipped with all necessary information to put forward to the child in a proper way, so that the child understands it and assimilates it. And I think the female child should not hesitate to go and seek any help from any teacher, be it a male or a female.
It should be before the age of 13, knowing that the fact that majority of the girls will have their first menses by 13 years old. By the age of 13, you have to incorporate the menstrual cycle.
But I think anywhere from the age of 9, they should start. They should start in a simple way. If you were to teach the child the anatomy and all those things, they are going to get, they're not going to be interested. It should be put in a way that the child at that age will understand it and assimilate it and act accordingly. So she won't be shocked when found in such situation,
Yes, absolutely. Now, if you are educating just the girls without the boys, it makes no difference. The embarrassment is still going to be there. The making fun of the other sexes when they are having menstruation is still going to be there because they are not sure what is going on. But if you educate both the men and the girls, or both the boys and the girls about the changes, then there's nothing to be ashamed about. It's just a normal biological changes, a normal body changes, and both sexes should understand what is going on, and that will actually reduce the so-called embarrassment and the so-called reluctance to bring out the topic during the class.
Of course, because every boy is somebody's son, he's somebody's brother, and he's going to be somebody's husband, and he's going to be somebody's father and grandfather. When a male is going to play such an important role in a female's life, it's his responsibility to make her feel good about herself, make her feel proud of herself, and not ridicule her in any way because of something that's happening naturally to her body. I think it does a lot of trauma to her mental makeup as well, because she feels embarrassed and she feels inadequate and she feels unprepared. And I think, being a doctor myself, I did go through such situations, and I'm sure every girl would have gone through similar situations as well. And she'd rather stay at home and not be embarrassed by whatever things that the period might bring on. And that's going to affect her education. She's going to miss valuable classes. And that's not good, because she's not getting equal opportunities when compared to her male counterpart. But if all that are met, and if she's prepared and if she's confident, I don't think so any female child would want to miss class because of menstruation.
Okay, now what I can think of, if someone is ashamed and afraid of having menstruations, they won't feel comfortable attend to the class and get their proper educations. So if let's say that the girl herself, she has to understand that it's part of her normal changes. So if she is not ashamed of it, she treat it as part of their daily normal life, and she would just continue with the educations. If let's say she's feeling embarrassed, she's not keen to go to school whenever there's menstruation, that means 4 to 5 days per month, you're going to be away from school. And of course, they will ultimately affect the educations.
हाँ जी सुना था बीमारी का नाम तो सुना है शायद बीमारी है महामारी की हाँ सुना था जैसे बीमारी ज्यादातर लेडीजों को होती है
This is the girl's problem.
it's very detrimental to the health of a female child, because it's going to eventually lead to urinary infections, vaginal infections, and uterine infections. And that has got a possible effect on her fertility in the long run. And it could also predispose to infections and sometimes even cancers. So it's very, very, very important that the child changes her pads, maybe at least a couple of hours or 3 hours max. And she should be provided with provisions to do that quite frequently.
Now, the importance to change the pad regularly, especially when it's soiled, is to reduce the infections of the reproductive tracts and also your urinary tracts. So the urinary tract infections and also the vaginal infections will actually increase if you have a soiled pad left inside you for a long period of time.
If the sanitary dispensing whatever gadget or whatever it is, if it's kept in the toilet, then the girls actually will not feel embarrassed to go and ask for it in a different area, which is a med bay or something like that. And I mean, they don't have to depend on anybody. When they go to the toilet, they will be reminded to keep changing their pads rather than use the same pads.
All right, now if you're talking about sanitary pad dispenser, it is not something uncommon. Yes, you mentioned it before. You have seen it in the airport. In fact, you will see it quite frequently in the toilet settings in overseas country. Now, in fact, there are a lot of variation available. You will get those typical, what do you call these things? You will get a typical the electric kind of dispensers around. You can also find a slightly older version where you only need coins to operate them. For example, you put in 2 50-cent coins, you turn a few knots, and then a pad will drop out. So all these different variable machines are available. And yes, in the school settings, when you find it difficult to purchase it, and it will definitely be a good idea to have it installed in the toilet, in the female toilet. So
if you were to ask me, just like the national immunization program that the government has implemented, where they give out free vaccines to babies, I think distribution of free quality pads should be available at all primary and secondary schools and universities as well. And also amenities to first aid medications with regards to menstruation should also be available in all schools, so that the menstruating child does not feel incapacitated to attend school. So she'll be confident that even when she goes to school, she will be in a safe environment as it is in her home. So she wouldn't want to miss out on school. I mean, sad to say, it does. A menstruating child, unless she's properly equipped, doesn't want to attend school. For whatever reason, she has got an excuse: I'm menstruating, I can't go to school, I'm either ridiculed by the boys, or I'm in pain, or I'm embarrassed, or for whatever reason. So she's going to miss quality hours in school, especially when she is in a year in school where every day in school matters. And she's going to eventually lose out, and intellectually, when compared to the opposite gender, And this is going to create a lot of inequality in the society.